So good morning, friends. Uh, in today's class, we will talk about one superfamily under the Strongyloidea order, that is Trichostrongyloidea. Okay, so these parasites, as I told you, that they are one of the most important parasites of livestock. They are very important livestock parasites. That's why studying them is also in studying them also we will take a little bit elaborate, and we will go a bit slow, and in one class we will try to cover up one parasite or at the most two, and in that way we will try to studied about the pathogenesis, the clinical manifestations, and and and, and how the control measures is being taken and all this. Okay, so in today we will talk about the in general terms Trichostrongyloidea and one parasite, that is Haemonchosis contortus, which is one of the most important livestock parasites in India. Okay, so the general characteristic of Trichostrongyloidea is that, as unlike the superfamily Ankylostomatidae or Ankylostomatoidea, sorry, that the mouth is very much reduced. In case of Ankylostoma, if you remember that they are having a wide open mouth with presence of teeth, right? But here in this case, the mouth part is reduced, and unlike Strongyloidea, the coronary data also is absent here. Okay, so under Trichostrongyloidea superfamily, we are having three family. One is Trichostrongylidae, Olulanidae, and Dictycaulidae. Dictycaulidae. Okay, so Trichostrongylidae is one of the most, the parasites under Trichostrongylidae are the one which we are going to stretch most. And in their course now, they have omitted Olulanidae, but we will talk about Dictyocaulidae also, which is a long one. Okay, so mostly the parasites under Trichostrongylidae, they are belonging to, they are mostly residing in the in gastrointestinal tract, whereas Dictycolidae, they are mostly resides in the respiratory tract. That's why they are known as lungworm. Here, under the family Trichostrongylidae, the characteristic is that they are, it seems like there is practically absence of buccal capsule, but the bursa is very well developed. As I told you that they are usually the parasites of gastrointestinal tract. They are, most of the parasites are small, not even 1 centimeter. Some are even half a centimeter length only. That means 5 millimeter in length only. Trichostrongylidae. Tricho literally means hair-like. Okay, they are literally mean that it is hair-like. So there are important parasites, like one is Haemonchosis contortus, another one is Mesistoceras, and very important Trichostrongylus, Couperia, Osterthagia, and Nematodiras. Apart from that one, there could be Marcellegia and Graphidium and all this that we will not talk about in your undergraduate course. We will focus in today's class is Haemonchosis contortus, Haemonchosis and Mesistoceras, which are, of course, they are, even though in the general characteristic, the buccal capsule is absent, but these two parasites, they have a small buccal capsule and they are bloodsuckers. All right, Haemonchosis, as I told you, that this is, I should say, no doubt the most important infectious organism in India in small ruminants. Not only in India, you may say it in where the livestock is being reared popularly, like Britain, like in Europe, Switzerland, and all these places, and Australia in many parts, especially southern United States of America, where grazing and western states of United States, where there are range of animal, and when there are the animal are livestock keepers are more in number, and where there are higher animal population. So Haemonchus contortus is one of the most important infectious organism. Okay, so the parasite is located in abomasum. As I told you that they are located in the gastrointestinal tract. Here, Haemonchus contortus is the one which is infecting small ruminants, whereas Haemonchus placei is infecting large ruminants. In recent books, if you read, they say that there is no more Haemonchus placei, that is a variant of Haemonchus contortus only. But for our class, let's say that there are two species. One is Haemonchus contortus, and another one is Haemonchus placei, which is infecting large ruminant. Okay, so they are these parasites. They are commonly known as they are small worm. They are wire worm, or sometimes they are known as stomach worm, or sometimes they are known as barber pole worm. This is the barber pole. Okay, so this is the red and this is the white structure that I will come in the next slide. Okay, so the characteristic of Haemonchus contortus is, as I told you, that even though in the family characteristic is saying that there is the mouth part, the buccal capsule is absent. But here in this case, if you see here, there is a small buccal capsule here. There is a small buccal capsule here. Okay, and with presence of a dorsal lancet. This is the dorsal lancet. If you can see the darker area within the buccal capsule. This is a small buccal capsule, and in that one, this darker area, this one, and this one are the dorsal lancet or dorsal teeth. Okay, so why it is barber pole worm? Why it is commonly known as barber pole worm is that the white ovary is wound around by the intestine. Okay, the white ovary is wound around by the intestine. So as I told you that they are having a teeth, that means they are a bloodsucker. Okay, so if they are a bloodsucker, naturally their intestines will be reddish in color. All right, so this is known as barber pole appearance, and you can see here in the picture also. This is the red intestine, and this is the white ovaries. Okay, this is, of course, this is a worm. Okay, so in this, the parasite looks like this barber pole. Okay, that's why they are commonly known as barber pole worm. In female, that is the characteristic of a female, and another characteristic of female is that the genital opening is covered with a cuticular expansion known as vulvar flap. Okay, there are two types of vulvar flap. One is linguiform. That means a tongue-like. This is actually a linguiform, and in some books and in the internet, you can see that there is a button form, which is something like your shirt button. There will be a round button which is just present here, something like around here. Okay, so I'm repeating the characteristic of Haemonchus contortus. The mouth, they are a small worm, hardly 1 centimeter, maximum in 5 to 7 millimeter in length, maximum 1 centimeter in length. The bulk, there is no special characteristic in the cuticular expansion, especially at the anterior region, unlike the esophagus which is having cervical alley, cephalic alley, cervical papillae, nothing like this. You can see this looks plain, right? So, but in case of if you come to the mouth part, there is small buccal capsule with a small lancet or a small teeth, which will help in penetration into the intestinal, into abomasal wall. Due to that conditions, the parasite is able to draw blood, or the parasite is able to suck the blood of the host. Okay, so due to that blood feeding nature, the intestine is red. So the intestine, which is reddish in color, is winding around the ovaries. So this is known as barber pole appearance, or you can commonly known as barber pole worm. And the genital opening of female is covered with a cuticular expansion known as vulvar flap, which could be linguiform, a tongue-like, or which could be a button form, just like your shirt button. In case of male, the bursa is well developed. I told you that the bursa means which is the expansion of the posterior extremities of male, which embrace female during copulation. Okay, here this is the lateral lobe, this is the another lateral lobe. Okay, this is the dorsal lobe. This is the dorsal lobe. The dorsal lobe is asymmetrical. That means which is inclined towards on the left side. This is from the from the ventral view. The dorsal lobe is this is the right lateral lobe. This is the left lateral lobe. The dorsal lobe is inclined towards uh, the the right lateral lobe. So there is a symmetrical dorsal lobe, and very important is that there is a Y-shaped dorsal ray. If you can see here, Y-shaped dorsal ray. What is the key ray? What is the lateral, bursal ray? Bursal ray are something like a skeleton structures, not actually bony, but something a bit hardened structure, which support the bursa. Okay. The next point is that there is presence or there are presence of true spicule 1 and true spicule with a barb tip. That picture I'm going to show you in the next slide. And the bursa is the spicule is supported by a gubernaculum dorsale. This is the accessory sexual organ in case of male. Okay, this is the male bursa. This is from dorsal view. This is the right lateral lobe. This is the left lateral lobe. So the dorsal ray is inclined towards the right lateral lobes. Of course, the lateral lobes are very well developed. Okay, so there is presence of an Y-shaped dorsal ray. There is presence of Y-shaped dorsal ray in case of male. In case of female, another one is in case of male, there is the spicule, which is the copulatory organ, which is having a barb, means which is a knob tip, K-N-O-B, knob tip. Okay, and in case of female, the genital opening is covered with cuticular expansion known as vulvar flap that we have seen. And in case of either in case of male or in case of female, there is a small buccal cavity which is having a dorsal lancet. Coming to the egg, simple a typical strongyle egg, which is containing a thin cell egg and containing a different stages of segmentation of the embryonic mass. It's quite simple. If you come to the life cycle is so simple as that. The parasite will lay 5,000 to 15,000 eggs per day, and the egg, after, if it is conducive environment, when there is sufficient warmth and moisture, they will hatch out into L1, L2, L3. L1 and L2 will feed, L2, L3 will cease to feed because it is covered with the sheath of L2, and also that it is devoid of the muscular esophagus, which is the rhabdidiform esophagus, but L3 is devoid of muscular esophagus. It is having filariform esophagus. Okay, so subsequently, this L3 will climb through the grass blade in presence of moisture during morning hour and during evening hour. Okay, so the parasite, the L3, the binomics of L3 is that it is negatively geotrophic. That means it is migrating away from the earth surface, or the ground, and but it is, and also it is positively phototropic. If when in the morning, due to the sun rays, the parasitic larvae move up, migrate, they slide up to the grass blade. But during the sultry day, they will descend down into the ground, they will hide somewhere so that they are not killed by desiccation. Okay, so when this plant is eaten by the sheep or goat or cattle, and subsequently the cycle completes. Very, very simple life cycle. Okay, so this is what happened inside. Okay, so the parasite, they are once L3 enters inside the host, what happened is that they attach deeply into the wall, and due to their dorsal lancet, they cause laceration. Okay, they cause cutting of the abomasal wall, so there will be bleeding. The pool of blood they are drawing in. Okay, so this is how the parasite is feeding. Adult parasite feed on the blood in the abomasum. This is the repetition of the life cycle. Okay, coming to the pathogenesis, the most important one. Understanding the pathogenesis is important. Okay, here anemic condition is the principal pathogenesis. First and foremost, and the first point I'm putting here is that anemia is the principal pathogenesis. Okay, and you see here, this is the dorsal lancet which is projected out. Due to this, the parasite lacerate, or the parasite cause nick, N-I-C-K, in the abomasal wall. Due to that condition, there will be pool of blood that will be oozing out, so the parasite is drawing that blood up to 0.05 ml. That means 50 microliter of blood per parasite per day is ingested by a parasite. Okay, so there could be thousands, there could be tens of thousands of parasites in the abomasum. So what will happen? How many blood will be low? How many blood will be lost due to the parasitic infections? Okay, so the parasite, the pathogenesis is divided into certain stage. One is the first stage. It occurs during first 2-3 weeks, 1 to 3 weeks of infection. Here, during this period, the PCV of the pec cell volume will drastically reduce from 33 to 22%. Okay, that means the number of RBC just reduce severely, drastically. And in the second stage, which occurs from 6 weeks to 14 weeks, from what should I say, from 1.5 months to 14 weeks, means 3-4 months. So the PCV is of course maintained, but the PCV is maintained at a lower level, somewhere around 28-26%. And during this condition, there will be development of anemia. They will be starting to development of anemia. And in the third stage, when the iron reserve of the body is continuously depleted, ultimately it results in anemic conditions. And there will be further drop in the PCV, and there will be homeopoiesis. Then the animal, the mucous membrane will be, instead of reddish or pinkish in color, it will be bleached, it will be white. Okay, so the animal will not be at all productive in this condition. The animal will suffer from reduced growth rate, reduced milk yield, and reduced wool growth. Not only that, they will be prone to secondary bacterial infections or any other parasitic or viral infections. That means the immunity is lame in these conditions. Here comes the clinical manifestation. Due to that conditions, there are 3 types of clinical manifestation. One is hyperacute. It is not common, and it is due to ingestion of a massive amount of larvae in a short span of time, and the animal die during the prepatent period. The prepatent period is usually within 17, 15, 16, 17, 18 days. Okay, so the animal could die within 2 weeks. The next is acute form. Acute form usually occurs when the there is development of 1,000 to 10,000 worms inside the abomasum. It is seen primarily in young animal who ingested large number of larvae, and the anemia develop fairly rapid. During these conditions, there will be hyperproteinemia and there will be edema, because due to hyperproteinemic conditions, there will be edematous conditions. That means the fluid leak out in the intercellular space. Subsequently, there could be a edema of the intermandibular space, known as bottle jaw. I'm repeating, due to hyperproteinemic conditions, sorry here, it should be O, okay, hypoproteinemic conditions. During this time, there will be edematous condition develop, and due to edematous conditions in the intermandibular space, there is a condition which is commonly known as bottle jaw. Many times, acute form is also terminally ends with the mortality of an animal, of the death of an animal. Coming to the most important one is chronic haemonchosis. It is very common and there is 100% morbidity. As I told you that more than 95% of the small ruminant populations in India are infected with haemonchosis, especially chronic form. Of course, the mortality is low, but as I told you that the morbidity is very, very high, and large number of animals are infected. So the animal show anemic conditions, weakness, and emaciation, and sometimes hyperproteinemic conditions will develop. But the most important manifestation will be the anemic conditions and weakness and emaciation. And one thing that is, I'm repeating from the previous class what I told you, that if you calculate in economic terms, as I told you that scientists, they estimated that around 2 kilograms of mutton or chevon is lost due to haemonchosis. 2 kilograms of mutton or chevon. If you calculate in monetary terms, 2 kilograms means 700 rupees. How many livestock we are having? How many small ruminant livestock? 150 million or 70 million, 150 million of what should I say? Goat population, around 70 to 80 million of sheep population. Calculate, just multiply with 700 rupees. How much of money can be saved due to these conditions? Of course, the mortality is low, but the morbidity and the economic loss which incur by this parasite is immense. It is relentless. It's colossal loss we are seeing here. That's why the parasite is really, really important. As I told you, that this would be the most important infectious organism as far as small ruminant is concerned in India. No other infectious organism would match the economic loss incurred by these parasites. So if you see the post-mortem, there will be mucous membrane and skin will be pale, and the mucous membrane, as I told you, that it will be bleached, it will be white, and it will not be pinkish anymore, and the blood will be thin and watery, and there will be due to the hyperproteinemic conditions, the fluid leaks out in the intercellular space. Not only that, they will be leaking out into thoracic region, hydrothorax, and ascites. That means water in the peritoneal cavity, or sometimes water in the hydropericardium, or water in the peritoneal cavity, known as ascites. Okay, and the abomasum so bite mark. Coming to the diagnosis, history of course is important, but clinical signs and symptoms and fecal examination demonstrating the egg is important, and the serological tests like ELISA and postmortem examination, these are all important. And now comes the most important one, that is a control part. We are having here two control measures. One is within the within the individual organism, and another one is in a population. Within the individual organism, we call it as infra-population control, and the another one we control in a population, we call it as supra-population control. Okay, so here by using anthelmintics like benzimidazole, ivermectin, benzimidazole group of drugs like albendazole, fenbendazole, mebendazole, oxybenzole, all this, and ivermectin and imidothiazoles like what I have discussed already, that levamisole and tetramizole. And now comes in from Britain, they have one vaccine. They marketed, this is known as Barbarvex, which is the native antigen of some parasite extract. And in South Africa, they have developed one concert known as Famacha. This I forgot to write here. Then I will just write here FAMACH. Famacha means they say that we should not give treatment to every group, every animal which is infected with Haemonchosis, because earlier they used to give treatment to every organism that invites anthelmintic drug resistance. Now in India, the alarming situation is that most of the, benzimidazole groups, many times they are no longer working. There is the parasite develop drug resistance. So due to that conditions, they say that we will give treatment to only those animals which are suffering only. Okay, so the Famacha means this, when the eyelid color or the mucous membrane of the eye is compared with one chart, there is one color chart. Okay, so they are having a different type of scoring. Okay, so if they are having 5 level of scoring, one is very red, one is a little bit pinkish red, then below, then it goes down, and below the lowest one is the white one. Okay, so if the animal are below certain point, that means if the mucous membrane is white as compared with the Famacha chart, they say with that condition only we should give treatment. That is what Famacha means. Okay, that means Famacha means it is a strategic method of treatment where animal which are suffering due to where animal are suffering due to Haemonchosis are only treated. If not, even if they carry a high EPG, that means a high number of parasites, if the animal does not suffer from anemic conditions, they said let's not give treatment. Why? Because there is emergence of anthelmintic drug resistance. Apart from that one, in recent years, there are some breed of sheep which are known as red Maasai, which is present in Africa, and in India there is one sheep known as Garol, which this is the Garol sheep, which are comparatively resistant to a Haemonchosis controllers. That's why they said let's try to explore the germplasm of this Garol sheep and infuse in some other sheep, and all these breed resistance studies it's going on. Okay. Then the next one is suprapopulation control, like rotational grazing and pasture management, plowing and reseeding, which will destroy the microclimate of the larvae in the soil. Okay, below the soil, in the soil, below the grass blade, there are some leaf which are falling down, and that leaf provide, even if during drought condition, there is moisture which is present, and due to that condition, if we due to that conditions, if we can break or we can destroy that microclimate, then somehow we can check the organism, the larval survival in the ground. That is what the intention is. And another one is by biological control. Duodentonia flagrans, Arthrobosis, Oligospora. These fungus, they are fed to cattle or they are fed to sheep and goat. The fungus comes out, I mean, it does not hatch, I mean, does not produce spore or anything, does not cause any harm inside the ruminant. And when it comes out with the parasitic egg in the feces, in the cow dung, what will happen is that the fungus produce mycelium, which entrap the larvae. Very, very smart approach. This Deuterotonia flagrans, once it is fed to cattle, and it does not cause any harm, which is voided out in the environment with the parasitic larva, and in the environment, the Deuterotonia entrap the parasitic larva, and the parasite larva is dead. This is biological control. Okay, coming to the last one, that is self-cure. It is the end, just like crisis, it is the entry of the new population provides expulsion of the adult one. Okay, in primary infections, especially of the L3, there are certain enzymes like interleukin, leucine aminopeptidase, and cysteine proteinase, which prime the host. Okay, so when in secondary infections, when the L3 comes again, they release again the interleukin and LAP and leucine aminopeptidase and cysteine proteinase. What will happen is that as the host is already primed, it produce type 1 hypersensitivity. So due to type 1 hypersensitivity, there will be rise in blood histamine, and due to that condition, the abomasal wall contract, and apart from that one, there will be increase in the fluid content of the abomasum, which expel or which flush out the adult worm. Okay, so this is self-cure phenomenon. But a latent period of 6 to 7 weeks is required between the primary infections and the secondary infections. But this is not, of course, this is mediated by immunological, but this is not a sort of vaccinations. After self-cure, the next day, there is self-cure happens today in animal A. In the next day, the animal is again susceptible to new infection. Okay, self-cure is absent in Haemonchosis plasi, and self-cure is more effective in HB hemoglobin AA type than HBPB type. Okay, apart from immunological method, apart from the immunological procedure, self-cure might also occur during spring where there is less green pasture, so that might contain allergic substance. This also can happen. Okay, for the last slide, there is one parasite known as Mesistoceras, which is very similar with Haemonchosis contortus, which also located in the abomasum of sheep and goat, and the mouth part is similar with Haemonchosis contortus, but here the difference is that in case of female, there is absence of valvar flap, whereas in case of male, the dorsal lobe is not inclined towards the right side, it is on the center.